I request you, members, to work with us to expedite the legislations that we have put in place so that we can make sure that this program is anchored in law.
Tuko na malizia mambo ya public hearings na kufikia kesho we shall table the bills pamoja na ile digital health bill ambaye itahakikisha kwamba yale mnafanya kule mashinani agency ambayo itahusika naye itaweza kuyaweka katika health information system yetu.
Ya pili tuko na primary healthcare bill ambayo pia tunashughulikia na tunajua ndani ya wiki moja tutakuwa tumeweza kupitisha kama bunge la seneti.
The laws that have been proposed, the 4 bills that are proposed that are before parliament today, which have had very comprehensive consultation, and we want to confirm here today we are consulted as Council of Governors and we have given our input, are going to make sure that we have a uniformity in the whole of Kenya, where there is a CHV from Tharaka Nithi, Turkana, Mombasa. They are going to operate under the same standards.
All right, that is some brief excerpts from the event yesterday where President William Ruto was flagging off the community health promoters kits that will be distributed across the country, talking about the number of 100,000. We understand that on the day of Mashujaa, the president is supposed to launch the program of community health promoters. Remember, there had been concerns from different leaders, especially from the Council of Governors, saying that as it had been planned out in the bills, it was not consistent with the wishes of the Council of Governors. But now Muthomi Njuki, the chair of the Health Committee, is saying that indeed they have now agreed on what needs to be done. First of all, Philip, tell me about when you're looking at the health function by the counties, and now the national government coming in and saying that we are going to match a shilling for a shilling. Initially, there had been a figure of 2,500 shillings that would go to the health, community healthcare promoters. So 2,500 by the county, 2,500 by the national executive. But now that is changing. The president is not very committed on what that particular figure should be. Where do you think this conversation should lie in determining all those rates across the country, but also the service itself?
You know, Sam, first of all, the idea is good. It's a good idea. So let me give my brother Mauro some comfort that what is good, we shall say it's good. But what is wrong and bad, we shall equally call you out. So the idea is good. But I am a little worried on how they intend to execute. First of all, health is a devolved function. And as per the Constitution, and Mheshimiwa is here, it only refers to the national government when the two governments come to some form of understanding and say, okay, we can't pull this one through, we need some intervention for a certain period. I think a Kenyan in Mandera, a Kenyan in Vihiga, or a Kenyan in Samburu is a Kenyan.
Right.
So I agree with Governor Muthomi that there must be uniformity in terms of the product that is being rolled out, in terms of the services that will be delivered to the people, because the services are being delivered to one people called Kenya. So when the program is not uniform in terms of remuneration, some are proposing that the community health workers be paid a certain amount, others a different amount. I hear my governor, Governor Sakaja, has proposed 3,500, and I support, because this money is going to Kenyans. Kenyans need this money. At 2,500, I don't know how someone can survive with 2,500. The president is talking about matching a shilling to a shilling. I think we need to be clear, and we need to be uniform. If it is 3,500, it must be 3,500 across the board. And if there is any other fringe benefits be given, because depending on where you are working, because you know, there are hardship areas, there are areas like Nairobi and the cost of living is very high. I think those are factors that need to be considered. Yes, the services that are being given are the same, but the factors surrounding delivery of those services are different. Now, my only concern would be, is there a hidden agenda behind these 100,000 community workers, promoters? Is there a hidden agenda? Is there another hand that is under the table that is going to pull strings to convert these people into some sort of campaign agents? That would be my only worry. But the idea, I would support it. And I urge all Kenyans to support this idea. But we must have our eyes wide open.
Even if
we must have our eyes on the ball, so that if they change the course, they must be called out. They must only be used for the purposes, intended purpose, community health promoters, and nothing less, nothing more.
How would you check that? Because the president says that every CHP or community health promoter will be dealing with about 100 households, going there to check on the people, checking their vitals, giving certain communication on health precaution. How will you check what they tell them?
That is what I was talking about. There could be an underhand dealing that, these people could be programmed in a certain way to promote other messages other than promoting community health, community health messages. So we need to be alert.
Okay.
But it's easy to monitor. The people they are promoting these messages, this product to, are Kenyans. So we need to get feedback. They are not living they are living in a place called Kenya, and we're all Kenyans. We need to be alert and get feedback, so that the intended purpose is achieved. We should not have any dealings other than the intended purpose.
Okay.
So we need to be alert.
Okay, all right. Senator Mwaura, this was one of the key promises about rolling out the universal health coverage. So this is not, it's not everything about that program, it's just the start. And of course, the government has been saying it is key to develop or grow the preventive health care so that you don't get to a lot of curative that ends up being too expensive for everybody in the society. But how do you ring fence so that whatever the good thoughts there may have been are actually implemented for the benefit of the people and not what may appear to be contest about resources, especially when you see Council of Governors previously not agreeing on the figures, but also the financing and where that money should lie for such a devolved function?
Yeah, I think, thank you, Sam. Just before we come to that, I know my senior brother, Farah Maalim, was talking about a pure presidential as pure parliamentary system and the mongrel that we had before, which was a hybrid. And just to reiterate, I think, yeah, it is true. Well, for me, at some point, I was very much for parliamentary system. But the Azimio side, that time I was working for Prime Minister Raila Odinga, they went pure presidential. They are the ones who gave out that. So any kind of going back to that, of course, again, it's a backpedaling. And also, yeah, it's true. Yeah, it helps people to get the best kind of leaders. And you can imagine, Jonathan Netanyahu was actually killed in Entebbe, the Entebbe raid, I remember, recently in Uganda. So the Netanyahu family has really been in power for quite some long time if they were still active that time. But let me come to the topic here. First, I want to disabuse the notion by my brother Philip Kisia that this is a political army that is being recruited, because that's what he's trying to say in Kamapara na Marefu. The 100,000 CHPs are people already who are there. By this time, if you go to the ground, and any one of us who have really, because you see the work of a member of parliament, as I've said before, is nothing more than a glorified social worker. I mean, that's what we do. A lot of social work. And you interact with, we call them CHVs now, because they don't have a job per se. Community health promoters, community health volunteers.
Right.
And they do a lot of work. Many of the cases that I've had to deal with in Ruiru when I was running for MP, for the 2 times I have tried, is basically from the CHPs, and they are very good people. I wonder even how they survive these ones, because they even have to go out of their way, get money from their pockets. I mean, may God bless them, wherever they are, because I find the most altruistic, genuine people are the CHPs. Now, if they are to be put into a kind of a stipend, they are facilitated to measure, they are trained with basic skills, is extremely progressive. And the aim there is to ensure that we prevent, we prevent diseases from even people going all the way to the hospital, and prevention is better than cure. That is a clarion call. Let's even assume that there will be political, like Kise is saying, but really convincing people is not an art that you just go and say 100 households, they follow me. No, it cannot follow that way. So let us see, maybe this is an actually missing link that made the UHC not work under President Kibaki, under President Uhuru, much as they had very good intentions. But now I am very happy because even if you look at the 4 bills that are before the houses, they are really going to help in terms of ensuring that we have universal health care, in terms of even the contribution, in terms of the monies. Yes, of course, there are teething problems around which level of government does what, but there is a lot of consultations, and that's what I really credit President William Ruto. Consultations with the Council of Governors. Now you can see Muthomi Njuki is actually accepting that they have now come into an agreement. That way, you'll get more results, you yield more results because nobody is taking from the other. If for example, these 100,000, CHPs, the resources are actually provided for in terms of the ordinary shareable revenue as part of the formula for the division of revenue bill, then it's an increase to the counties. It's a new avenue where you'll be calculating how much money goes to the counties. And as somebody who's been in the Senate, I can tell you for sure it helps, it boosts in terms of the counties becoming more efficient in terms of what they're doing. And of course, we also believe that albeit the teething problems that were anticipated in 2013, 2017, 2022, now counties are more resilient in terms of shouldering the responsibility of the devolved function that is health. There are always issues around the human resource, the managing of doctors and what have you, but I think things are now settling, and sooner than later I can tell you for sure.
Senator, as we speak here, already 3 counties are in trouble because Nyamira County, the workers, healthcare workers, they have down their tools, that is the doctors. In Meru, they've given a 14-day notice. In Nakuru County, they're expecting that this morning they're out of work because they'd given a 21-day notice that expired yesterday. So there are several things you haven't resolved, especially when it comes to health professionals. And therefore, even when you introduce another layer of community health promoters who are supposed to be supervised by medical professionals, how does that work? And how do you promote universal health coverage when the critical staff is not satisfied?
I think out of every conflict comes solutions. And I'm happy that there are only 3 counties out of 47. And so I am very confident that we still find a way. The problem is sometimes governance issues to do with the governor. There could be other underlying issues that may not have been resolved by the previous administration, but I'm sure they are going to find a way to ensure that that is the case. It was the same thing in Kirinyaga, if you remember, under Governor Waiguru, but now we don't hear the same complaints. So I think it's a learning curve, it's a learning process. And if you look at even the governors that are there, all of them are new. Nyamira, Meru, and Nakuru.
Nyamira is continuing.
Is it?
Yes.
Oh, I beg your pardon. I thought it's a deputy was of Nyagarama maybe. So I think the issue is even him. He's just stepped up to become governor fully, and so therefore they will be able to learn. And I'm sure they even in their committee, Muthomi Njuki being a second-term governor, they are also exchanging the best of practices. So I think the problems will always be there. Even national government has been in existence since 1963 or even earlier, and we still have what we call industrial action by unionists because they have to keep on agitating for better terms of their people. Even CHPs at some point, they will want to demand for more, but them getting in there is a game changer. 100,000 individuals who are going to be employed. Right. These are the hustlers, Sam. These are the people that the president promised that he's going to get employed. And you can see they're adding to the 56,000 teachers, they're adding to the many other people who have been recruited under KRA, 1,400, and even the army. So it's the jobs that Kenya Kwanza administration promised are coming to the people. And the CHPs, when they are given that opportunity at the grassroots, it's a life changer because one and foremost, you get somebody to be employed, but also you're improving the healthcare of those people down there so they become more productive. It actually enables us to ensure we have a better human development index.
Okay. Yeah. That's interesting.
Can I just, before you jump on to my brother.
Can I hear him first?
Just 1 second. It is sad to hear my very good friend Maura talking about a remuneration of 5,000. I mean, it's a step forward. But how does somebody survive with 5,000 shillings and you call that employment? Is that not underemployment?
No, I think let me answer.
No. I mean, 5,000 shillings.
No, Philip Kisia is a rich man tycoon. He's here in Nairobi.
No, I'm talking about...
And he has a lot of money. Let me tell you.
I'm not a member of parliament.
No, it's okay. 5,000 makes a lot of difference on the grassroots. That one I can tell you.
No, listen. You know, remuneration is about what you're putting in and what you're getting back. You're being remunerated.
But
Isaac, you're being remunerated. What I'm saying is, what I've said is a step forward. But as we move forward, we should be thinking about how best we can remunerate other than making political statements. I know it is good to say now we've employed 100,000 people at 5,000 bob. Okay? It's a step forward. But Mwaura, hiyo ni kunyanyasa wananchi.
No. Personally,
we should be talking about facilitating them. Mwaura, we should be talking about facilitating 100,000 people to assist other Kenyans in terms of health issues.
Without belaboring the point, let me have...
Senator, you can clarify this.
Yes.
So you're calling it a stipend, assuming that there's an agreement that it's going to be standard. It's 5,000 contributed half by both levels of government. What else are they supposed to be doing with their lives? Because 5,000 for a whole 30 days?
No. I think these are volunteers per se. They are promoters. So they will also be engaging.
They're not employed.
They will also be...
not wanted.
No, you're not right. You're not right on that one. It's part-time. You have part-time engagement, part-time employment. And I know some...
So the rest of the time, what are they doing?
But they will also be doing other businesses. They always do so. We also are not anticipating that all of us should be sick and therefore seeking medical attention all the time.
No, they are supposed to promote health programs within the families.
Yes, and that is not necessarily a full-time engagement. So before, they were getting nothing.
That is what I'm
now,
asking you. Senator, I think you're not hearing my question.
Yeah.
What else are they doing apart from promoting health programs in the homes?
I hear you, but they also have time to do other things for themselves.
Like what?
You get the point.
What?
But why would you ask another what they are doing for themselves? They could be running some small business.
I'm being practical, Senator, here, because let's assume someone has basic training on health, and so they are a promoter, so they need to go to 100 homes within a month, or whichever period there is. What else are they doing?
The question is, even right now, the CHPs who are already doing, let me finish, who are doing this kind of work, they also do other things. What they are being committed to do is to promote, community health. They are being committed to monitor the health of the various households that they are going to be in charge of. And they are being given a small stipend. They are being facilitated. They are being given equipment. Now, currently, they don't have.
What is the qualification at the moment?
And that is very, very, very important. I think the nitty-gritties will come out with time. Okay. But for sure, it's more voluntary. And so a stipend of 5,000 is very, very important, because if you look at even the Inua Jamii program, the government usually gives about 2,000 shillings to the households. Households, not even an individual, households. So 5,000 really for me is okay. And also, it depends on the level of development. When we get more resources as a country, when counties are able to raise their own source of revenue, at some point there shall be some review. Okay. So we must really commend the government for taking this very bold initiative.
I hear you. Mheshimiwa Maalim, as we talk about this, you look at the Control of Budget report, and she says that much of the resources is actually going to recurrent expenditure. Well, the budget was that only 14 counties would have spent less than 30% on development. But when it comes to budget implementation, the bigger chunk, actually more than 60% of the counties spent less than 30% on development. If you look at the march that the health function is taking, it is 56.3% of the wage bill, at least in Baringo counties. Some counties are higher, some counties are lower. So health and resources are tied because health programs have to be delivered using resources. Is this a step in the right direction? But how do we make sure that indeed this universal health coverage does not remain a dream and an aspiration, but it is achieved in proper function?
To begin with, there was never any rationalization in the recruitment policies of almost all the counties in the country. People earn salaries and they do nothing there in all the counties. Most of them are in Nairobi and doing their own other things, and they draw salary. In some cases, there were even people who were living outside the country who were getting money every month sent into their own accounts. So somebody needs, first of all, to do all these things, remove all those ghost workers, rationalize the thing, maintain not more than 25% as recurrent expenditure. Ordinarily, I would have said 15%. But let's say 25%. And the rest of it should be delivery in terms of programs and projects and development. Now, it's because you have to have a lean, mean, efficient staff. serious people who are going to work there and who work day and every day and if possible even every evening have certain hours to contribute. As to where the rationale of employing the CSPs, do they call them promoters? Am I right?
Yes. Promoters.
Yeah, promoters. Yes. I do see a lot of wisdom in that. But 5,000 shillings. I mean, at the rate the inflation is going in this country right now, when even if that CSP is living in a small madhouse, would need 100 shillings to buy kerosene to lit the lamp for his own daughter or son to read. And then that works out at the end of the 30 days, that's almost 3,000 Kenya shillings. And then you give him 5,000 shillings. That's an insult. In my opinion, even if we give them 20,000 and tell the county government contributes 10,000 and the central government contributes 10,000, it's only 2 billion shillings at the end of the year, at the end of the month. You get my point? And it's only 20 billion shillings at the end of the year. There is massive wastage everywhere. Everywhere in the government. The previous one, and even now we have not been able to tame the wastage. And all institutions, all arms of government, all of them are wasting money like hell. We need to rationalize that and put some kind of a structural, a self-instilled discipline for us to save money, to take care of 100,000 people out there. That money can be saved from everywhere.
So how do you do that? Because the Control of Budget continuously keeps saying that the money being spent on development expenditure is reducing because the recurrent expenditure keeps rising, and especially in personnel emoluments.
But in the wrong ways, let me be honest with you. In the wrong ways. We have to curb travel by all arms of the government. The billions of Kenya shillings that we spend on travels. The president went to New York last time. How many people went with him?
I haven't counted.
Big number. Wherever we go, there's so much wastage you can't imagine. Counties are doing what you call benchmarking and sending people outside the countries. What do you need to benchmark to go outside the country and to spend a couple of million shillings on 3-4 people? Everybody, the legislative arm, the judiciary, the executive. There's so much wastage in this country. So much wastage. I want us to be pinpoint and be critical. I was talking to a friend of mine in Parliament the other day, and I said, why don't we do our meetings in Parliament rooms? When I leave you here right now, I'm going to run to one of the big hotels, 5-star hotels, to chair a meeting of my committee there. One of the reasons is because that very big, tall building you see there, there's a contractor who's supposed to get it right way back. We should have penalized him. We should have forced him to get it right. We should have had back pay, charges. And we should have even threatened him that all additional costs that are going to be incurred for the lack of use of that premises itself is going to be debited to that contractor.
What is the problem now, that he can't use it?
I don't think the contractor did such a good job in maintaining the timelines that were there.
Okay.
We have a problem with the time.
So it's not ready for use?
It's not ready for use yet.
Okay.
The Speaker has been shouting hoarse and pushing very hard to get that done. We don't do it. The travels outside by all arms of government. Wastage, massive wastage. You don't need more than 2-3 people to do and bench.
The institution you sit at is actually the highest because it's
I know that. That's why I'm telling you. That's why I told you by all arms of government.
Yeah.
I'm also basically indicting myself. And indicting my own, what do you call it?
So is it possible to, what you just told your colleague, is it possible to institutionalize it?
Absolutely. I mean, the amount of wastage that the county governments engage in right now, that's the money that would go a long way in taking care of 2 billion Kenya shillings, 3 million, 10 million shillings in any county can create 10 million, even if you say, what, 10,000.
Yeah.
I remember one of the very good jobs that we had, and the current governor became very famous for in his first time, because he came in and was out for 5 years and has come back again now, is the Ugatuzi, the many ladies, about 3,000 women who are employed on the madenge, you know what I mean, that tree, that very invasive tree.
Right.
To cut off those trees and keep the cities clean and the towns clean. And they were paying them only 12,000 shillings. And it went a long way. Women educated their children through that. And how much is that? For example, 3,000 multiplied by 12,000 Kenya shillings. How much is that per month? You get my point? How much is that per month? 36,000 million shillings. But here you are taking care of 3,000 households, each one of them with an average of 8 or 10 individuals. And there are people who are in universities right now who are educated through that.
Right.
You see what I mean? So the money that we look down upon and say is a small thing for the elite in this country can do a massive transformations on the ground.
Right.
Counties are dens of corruption. Serious dens of corruption. Billions and billions are lost every year in every county. Somebody said the other day, my speaker said in a meeting we had a retreat in Mombasa. He says in this country every year we hold elections, general elections, and after the 5 years we increase our list of millionaires by another 47. After 5 years. There's an additional 47 politicians who joined that rank of billionaires in the country. 47 governors. You get my point?
Yet our institutions, Philip, appear not to be able to deal with that, especially the county assemblies that oversight these executives at the county assembly, at the county level. But also the ONSOS revenue is not growing. There's a spike here from 35 billion shillings to 37 billion shillings. But if you look at that rate, a whole 10 years, actually more than 10 years now, it is not growing as you'd have expected. It's still at in the 60s, regions of 60s in terms of percentage.
You know, sometimes I look at this country and the way we are governing it, and I feel sorry for our children's children. Because as my senior brother, Farah, said, that this country has sufficient resources to run its affairs. But the leakages in the systems,
it's just unbearable.
And you can't just imagine. If you look at some of the counties, their internal revenue collections are lower than they used to be 10 years ago. Yet their fees and charges have increased threefold. You have increased your fees and charges by 100%, 20%, 300%, and you are collecting less than the municipality or the city. Where is this money going? There are so many leakages that have been created. And that is why Mheshimiwa is saying that after 5 years, you have 47 additional billionaires. But you can't call them billionaires. They are thieves. These are just thieves. Because a billionaire works for, you work for your money. You create wealth. But these people have no industry. They are not in any form of business. They don't do anything. But they are stinking rich after 5 years. They're just thieves. These are thieves. You can't call them billionaires. Call them thieves. Okay? But Mheshimiwa also forgot that even in Parliament, there's a lot that happens. In Senate, there's a lot that happens. There are some of them who go there, walking poor. And I'm not saying it's a good thing. It's a bad thing to walk out rich. But you're walking out rich having done what? Having stolen public funds. So there are more. There are more than 47 billionaires created. I think we need to be, as a country, we need to be intentional.
Right.
We need to be, we need to be faithful to this country. We need to say that, we have done enough of stealing, because we steal every day. We have, serious leakages in government and wastage. It is so shameful. It is so shameful, extremely shameful, that you find county governments and even the national government spending billions of shillings on travel, billions of shillings on entertainment, billions of shillings on motor vehicles. Now, in private sector, the board will sack you within less than a week if you went buying a car for yourself as a managing director that is worth 40 million shillings. You must justify. Is there any justification for the executive to spend billions of shillings on motor vehicle, billions of shillings on Mandazi? Is that justification? Can we justify that expenditure? So if we can tame our expenditure, if we can tame our greed, because we are too greedy as Kenyans, particularly those who are holding public offices, they are too greedy. They just want to steal because they have seen maybe Maalim, they don't know that Maalim has been around for the last 30, 40 years working for his money. They maybe afford a fairly good vehicle, that Sam wakes up at 5:04 to be here, and he can afford to buy a good vehicle. You, as somebody who is in the executive, somebody who is in parliament, somebody who is in the Senate, you are stealing public resources and then paying any community health promoters 5,000 bob, and we are so happy. Please, my friend Maura, and I respect you, and you are my good friend, I hope that you'll be convinced by the time you're living here that the 5,000 bob is to facilitate airtime, just to give them airtime so that they're able to communicate. But it's not a remuneration.
Okay. And Senator, so again, I told you earlier that the control of budget was saying that most of the counties, apart from 14, had planned to spend at least 30% of their resources on development. But when it came to actual implementation of the budgets, it is only 7 counties that met that threshold of 30% going up, which I should name. This is West Pokot, Kilifi, Kwale, Mandera, Uasin Gishu, Baringo, and Marsabit. All the rest, which are 40 counties, spent less than 30%. In fact, there are several that spent less than 25%, including Kisii, that is reported to have spent about 5.7%. Kiambu, your county, is actually less than 16%. There's Machakos, there's Busia, there's Mombasa, there's Tharaka Nithi, all of them below 20% of expenditure. The total average for the counties is 22.8%. I mean, what is going on? Because when you look at the national level, it is only 14.8% of the resources that went to development. In the counties now, an average of 22.4. If you're to do the calculation there, you'll see that it ends up settling at about 18% nationally at both levels of government. What are we supposed to do now? Because we continue feeding into the recurrent expenditure. How shall we expand this economy?
Yeah, thank you, sir. First and foremost, I want to make a disclaimer that even myself, Isaac Maura, I do not spend 5,000 on airtime. Maybe Philip Kisii, and I have kept on saying that. You know, he's a former county boss. Maybe he's one of the billionaires. But anyway, I am, I've worked for my money. On a light touch. So let's say that 5,000, I still want to say, is a good start, and we must give credit where it is due, and I'm sure it is going to be increased.
Let's just move away from that.
No, I will come to the
You're right, he's right, so let's just move on.
But let me just make the point that the 5,000 is a good sum. Start, and also, yes, it's 500 million. 250 million from the counties. Remember, this same money is the one that is still coming from the government, ordinary shareable revenue. Because as we all know, counties have not been doing very well on their own source revenue. Now, let me come to the issue of, and so therefore, it will really give other Kenyans an opportunity. And it's also a springboard, even to the mainstream of healthcare as medics. Now, let's come to the issue of 30 versus 70. It is a requirement within the PFM law. And it is not new. In the previous Senate, it was actually 88% recurrent and 12% development. If you look at the previous report from the Office of the Controller of Budget, Agnes Odhiambo, who is now the Director General of Government Delivery Service. Now, so it's an improvement. If it is at 18 or 22%, as you have put it, it's a marginal increase, and it's commendable. I really hope it can be up to 30%. It is a shame that my Kiambu County is at 16%. Because what then we are doing, Sam, is that while we are losing a lot of money through the outsourced revenue, I wish it was automated and run by KRA, yeah, it would be much easier even if we are, because Kiambu tried with KRA and Kabogo, there was a lot of improvement. I know there are other independent, financial solutions to that, revenue collection solutions to that, but KRA is by far more superior than many of them. And so therefore, we are stifling development.
But why should we ask KRA to do it, yet there is the spirit of devolution?
No, in terms of, like, they can actually get the services from them. Okay. Even if it's KRA, they can actually hire them.
Hire KRA to do that work.
Yeah, because they have the expertise instead of going to get people who may not actually, if you collect money physically, you don't know, sometimes we hear people get money through gunias in the evening. And that seepage and leakage then can reduce. And if you go 10 years of devolution, the question that people are asking is, we have devolved over 3 trillion shillings.
What is done?
What is there for it to be shown? That is the question many people are asking. And we have what we call counter-devolutionism, whereby you get money, say, to a certain county, I don't want to mention any, but then it is stolen and they come and reinvest it in Nairobi because it is highly productive now that they have become businessmen. That way then it's counterproductive, it's counter-devolution, it's anti-devolution. And that has been the practice. There are good governors who have not left rich, by the way, and people like Kivutha Kibwana, I must commend him, the governor for Baringo Kiptis, the governor for Kericho Chepkonyi, and others that we can mention, who really cannot be said to have become billionaires. But it is true that with weak systems, especially in counties...
But when you reflect on what the impact they've left in the counties, is there something to talk about?
Yeah, Kivutha, there's a lot to talk about. Chepkonyi, I'm sure there's one or two. But Kivutha particularly, in fact, he has had an unqualified audit report, which basically means that then he was trying to do his best. Okay. So there are good examples, there will be bad apples. That's why some of them do not even finish terms. Like now in Kiambu County, I don't know what went wrong with us. We seem to have a very high turnover. We are now with the 4th governor. And I hope that things can actually change. But generally, there is a problem, Sam, in the real definition of what is development and what is recurrent. Is a gray area, So that needs to be, I don't know whether it can be codified in law or in some kind of manual, because that is where most counties don't do very well. Number 2, I think...
So you mean there are certain factors that are considered as recurrent but should be development?
Yeah, and vice versa.
Like what?
Let me not go into details, but they are there. Because sometimes when you, for example, let me give you an example. If you are building a classroom, or a school, let's say a school, if you're building a school, there are elements to do with paying the staff that are part of development, right? But in real sense, if they are permanent and pensionable staff, it is recurrent. Yeah. So you see that there are those gray areas. So it needs to be a little bit more guided so that even when we are doing these calculations, we get it right. And so therefore, that for me is a problem. Number 2, I think if counties would be commissioned to have also revenue going for development only, it will really help. So that it is not lost in these ideas of travel and buying of furniture and whatever. So that if we have a law saying every own source of revenue that is collected, because it's money directly from the people who may not be doing very well and who are struggling with their businesses, that money should go into making of hospitals, in making of ECDs, in developing of roads numbers category D, E, and F, those kind of words, those kind of areas. It will really now show the value of own source revenue, because then people would be saying, the money you're collecting from us here at the local level, where is it going to? But currently, as it is, it's a gray area. And I must concede that, yes, indeed, the counties need to do more. For sure, if you go to a county like Kitui, it was better than the way it was before, for sure, because I was there before devolution. If you go to a county like Kisumu, you can also see a fair improvement of the fact that they're now the devolution, because I know how it used to be before, and Governor Nyong'o, I think, has done a good job. But that's why even Malombe was re-elected, by the way. So the counties have done more, but not optimally. If you go to Busia, for example, and this is my personal opinion, there is more room to be desired by my friend Ojamong for the 10 years that he was there. But it's my personal opinion, is Isaac Mwaura. There's no scorecard here. So you'll have misses and hits, but even at the national level, the problem persists between recurrent and development. And yet development is a residue that remains when a term of government ends.
Interesting. I want us now to transition and talk about a bit of politics and some few things.